2, 1. What's up, y'all? Welcome to the Sports Medicine Broadcast. ATs share weird injuries on Twitter. This is actually Bubba is joining me. He was going to do a kind of a case studies, and then we were going to do this other episode, and we're just kind of going to combine them into a couple different short episodes, so you can just kind of jump in and out and hear some random stories. So Bubba's got some of his stuff that's strange that happened, and it goes along with what we did a couple weeks ago with Kathy and Thomas. And then also we're going to hear from, or I guess read the tweets that a bunch of people submitted about weird stuff that's happened and kind of give our commentary there. So this conversation is sportsmedicinebroadcast.com/war stories. And if there's a second, third, fourth episode, it'll be War Stories 2, War Stories 3, War Stories 4, that kind of thing. So if you go to sportsmedicinebroadcast.com/war stories, it'll have the show notes, and it'll have all these different tweets that people have sent in, and that way you can see those, click on those, get links to those, or contact the people to hear more, or whatever it is. So without much further ado, one of the things, March is coming up right around the corner, and Lori Beth, she's on Twitter. She wanted to thank Leah Cox in saying that Leah swept her under her wing and went out of her way to help her grow her confidence as an athletic trainer. She showed her firsthand what professionalism looks like, and she hopes to be half the athletic trainer that Leah is one day. So as we're celebrating athletic training, National Athletic Training Month, getting, is right around the corner from when we're recording this, I want to make sure that we are saying thank you to those people. That it's not just I think about them every now and then, but physically say thank you. So it's whether it's through me, the podcast, through Twitter in response to something I said, through a letter you write them, a phone call, something like that. Just say, hey, thanks for teaching me. Thanks for showing me. Because without those athletic trainers, most of us wouldn't be who or where we are today. Positive or negative, they either showed us one thing to do or one thing not to do. So Lori, thanks for responding, and Leah, thanks for being a mentor. All right, Bubba, you are up. So once you start us off with some of the war stories that you have, and then we'll continue from there.
I think the most recent one, the most recent one I have is 4 years ago in the fall. I had a 16-year-old athlete have a stroke on the football field at practice. So long story short, because we're going to try to get through a bunch of these, he made a tackle, got up, complained of dizziness. So you go through the whole thing, concussion, blah, 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 C-spine. Nothing added up. Had a facial droop. So I'm thinking stroke, but he's 16 years old. So I don't exactly think that's a high on my priority list. Goes to the hospital, gets a MRI done, and shows a lesion. And ultimately he had a defect on his septum that had a hole in his heart. And what they think is it was blocked with a blood clot. When he made the tackle and went to the ground, it blew the clot through and caused a stroke. A month later, he had the hole fixed, and he actually played football the next year. He kicked, and then he played soccer for 2 years after that. And he's doing well. I talk to him all the time now. Again, it wasn't something I was actually, I know my radar is something that would be wrong with a 16-year-old kid. And as I've spoken about that several times, I think the big takeaway for athletic trainers is we all for the most part, get locked into orthopedic injuries, and those are kind of the sexy things for us. And we've got to go back and brush up and stay current on the other things that aren't so sexy, i.e. something like this.
Yeah, I had never heard of a stroke before. You mentioned it as a 16-year-old kid. I mean, obviously, my grandpa had a stroke and ended up, killing him through the complications. But he was, 70, 80, whatever years old. But as far as 16, you just don't think that happens. So it's just...
Right. The interesting thing with that is researching it, because I even went to the ER physician, afterwards, and I said, "Hey, did you think this kid had a stroke when he first came in?" He goes, "No." One on my differential diagnosis list, high up there. And so when I got to researching it with this patent foraminal valve that he had, the defect, there's 25% of the population that has it. And so the question becomes, how do you know if you've got it? Well, if there's the old term called a blue baby. So if you're born blue or you're not oxygenating, they know you've basically got this defect and they fix it. But you may not know you have this defect, or if they find out you have this defect, there's parameters on if you fix it or not. If it's above a certain size, you fix it. If it's below that, you watch it. And I said, well, what are you watching for? And in essence, I say, well, if they have a stroke, then we fix it. I mean, and that's a little bit oversimplification, but that's pretty much how it goes, because there's a lot of debate on, you have this defect, should you fix every one of them? I mean, there's risk with every procedure. So again, just not something you expect to see in a 16-year-old population.
All right. So what else you got? You want to just go through some of these and then you'll throw some more in?
Yeah. About 18, I was trying to figure out how excuse me, I'm getting over a cold, how long ago it was. It was about 18 or so years ago. Had a swimmer come in, walks into my athletic training room at the high school I was working at, said, hey, my coach sent me over here to have you look at me. I said, what's wrong? She goes, I don't know. Well, I just happened to look up at her, and you're supposed to look people in the eye. I look her in the eyes, and she's got one big, huge pupil, and the other one's normal. I'm like, what'd you do? She goes, nothing. And she was a diver. And so that gets sent to the ER, obviously. And they have no clue why she blew one pupil and was acting and, functioning normally, other than the fact that when she was 3, she had fallen down her stairs and was in the hospital for a week or so with a concussion, loss of consciousness. And they think the only thing they can figure, and this was well before we understood concussions as well as we do now, which is still not very well, that in her dives, she hit that exact spot she had hit all those years ago and caused this. Now, whether she did or didn't, who knows? But she ended up being okay. But, again, you expect a kid to walk in normal with one blown pupil is not, not something you expect to see. So that was just a little oddity. And then
tell me a little bit more about that. So you said blown pupil. So was just the iris gone, like it was just all black?
Yeah, basically. Just huge pupil. And the other one was normal size.
All right. So when you did that, did you do any sort of like the light test or anything like that, and just no response?
No response. The other one responded. She could track, but that one didn't respond to light. And
so they thought that this was something that just happened. Like, was she still able to see with that blown pupil?
Yeah, she had some blurry vision, but she could function. She could talk. She was obviously she could talk. She was responsive, but everything was normal except for that pupil. So,
all right.
And my argument is, it's not my job to figure out why. That's their job. My job is to get her to people that can figure out what's going on. But that was just weird. I mean, they didn't let her die for the rest of the year, that kind of thing. But, like, what caused it? Well, they think I just hit that spot. Well, maybe you did, maybe you didn't. Again, that's not up to me. She was doing okay, and that's all that really mattered in the grand scheme of things. So
now, I know with you being diabetics usually will have problems with their eyes. Was that ever a question?
No, I mean, she had no diabetic history on any of her paperwork or anything like that. So, and that's typically more of a neuropathy, retinal neuropathy, not anything with, pupil reaction response.
All right. So what else you got? So you got a list.
3 different femur fractures, a mid shaft, a distal femur, and a medial femoral condyle fracture, all during football. The mid shaft was easy. The interesting thing was when I got to him, the way he was laying, I actually thought he had dislocated his hip. And so I just asked him, I said, can you manipulate yourself to lay flat, or, to get your body more square? And when he did, you just saw basically, what is it? The old adage, the first sign of a broken bone is a false joint. And you just saw a mid shaft just kind of, move there. And so my first instinct was, crap, I hope it didn't go through the skin. So I glove up and reach my hand down into his football pants, and luckily it was dry. So, I mean, that was easy. EMS and put a rod in there, had a distal femur. That was weird. It just was offset a little bit. It didn't have that he was tender, but it didn't have that proper look to it, and there wasn't a whole lot of testing we were going to do after that other than, was he neurovascularly intact? And then the medial femoral condyle one was, oh, it's an MCL. Oh, no, it wasn't. It opened up like an MCL, but no, it was knocked off. So that had to go get fixed.
All right. So in all your femur fractures, have you ever heard of somebody having a femur fracture and then walking off the field?
Of the ones I've had, no.
So you've heard of it before?
I've not heard of one, but that doesn't shock me that somebody would.
Because Derek Cook, he showed me a picture years ago. He had a guy. He was super strong legs, and he just like sheared the distal portion of the femur and broke it, and then the guy kind of like limped off the field.
Yeah.
So then they get him afterwards to the ER or whatever it was. I was like, I've never heard of someone having a femur fracture and walking off the field.
But think about in the Olympics, you've got this snowboarder that fractured his cervical spine and finished the run. So, I mean, it happens. You've got these fractures that people, I know of a cervical fracture in football, collided with another person. He just said his neck was sore and he had motion, no deficits. But the other guy's loopy as can be with a concussion. The neck, they finally, after they look at him, they refer him to the ER. He walks into the ER and ended up having to get stabilized. You don't expect an unstable cervical spine fracture to walk into the emergency room either.
Right.
So, I mean, anything's possible.
So this is not in anything related. This is just a story somebody told me, a guy that goes to my church. He was up on top of the fence and like fell off. And he actually like was holding his head up. It was stabilizing his own head while his dad drove him to the hospital. And they ended up like sending him home without anything. I don't know if they did. I don't know all the stories, but he said they ended up having to go to another doctor. And he ended up having one of those halos, where they screwed into his head, and he has, I think he has 3 vertebrae in his neck because they're fused. They're fused, and fused. And so just the stories, I should have found out more, but I wasn't thinking about that beforehand. So,
and then I guess my last one is that I actually dealt with was a knee dislocation with no distal pulse. So, and we reduced it on the field and the pulse came back. So, I mean, but that's also probably another podcast on reducing dislocations stories from there. So, because I'm all for trying to reduce them.
Yeah, that's some people are very adamant about not reducing dislocations. I go with what like Dr. Shoop at the Sports Medicine Update. Almost every time I've been to a workshop, a doctor said, if there's a fracture, try and reduce it. If you can't do it, get it on the second time. You just package them that way and send it, right? Because you're going to reduce the damage. You're going to increase the comfort.
Right.
So that's what I go with, and I give it a shot. If I can, I can. If I can, I can. So
my physician that I dealt with that told me this said, I don't want to see a dislocation in the emergency room that you didn't try to reduce. So, okay.
There you go.
So,
all right. So we're going to get to some of these that are on Twitter. Again, I tweeted out, hey, what are some of the strange things you have seen? And I got a whole lot of responses. So we're going to read through some of them. So we got Alex, which is Alex_day19. It's got 3 of them. All right. Can you see the list, Bubba? You're just going to comment. Okay. All right. So Alex had a kid fall in the shower after a game and had a puncture wound in the calf. Said no one could find the sharp object and it didn't bleed after the initial skin break.
Well, okay. I'm just shocked that the athlete was actually showering. That's the first response I have, because for whatever reason they don't anymore.
Right.
They ought to build schools without them. They could save a lot of money. There's no telling what cut him, honestly.
Yeah. I one time in college had to go working with volleyball into the shower, or like the shower area, because one of the girls had passed out or something like that. I'm the student athletic trainer, and I don't think she was showering. I think that maybe she went in there to like puke and passed out or something like that. I don't remember everything, but it's always kind of weird.
Yeah.
All right. Testicular torsion.
Ouch.
What's your personal experience with that, Bubba?
My personal experience is none on myself or others. So,
All right, I should have looked it up, but what is testicular torsion?
all right, if I remember, that is you're basically twisting the testicle to where.
I'm about to get fired for Googling testicular torsion.
Actually, no, you're not.
Testicular torsion occurs when a testicle rotates,
Loss of blood flow,
twisting the spermatic cord that brings blood to the scrotum. The reduced blood flow causes sudden and often severe pain and swelling.
We did have a baseball catcher take a 92-mile-an-hour fastball off the plate one time, and that thing swelled up so big it broke his cup, and he had to go see the urologist and get a little treatment for a while.
So I saw a thing on like the sports science or whatever those things are where they like slow things down and show how they work. It was is it Smoltz has the Nut Buddy, Nut Buddy cup. So it's like a cup that's specifically made to
where they fire like the ball right into theirs.
95-mile-an-hour fastball office.
Yeah. I'm not going to be the guy that's willing to test that thing.
No, he stands behind his product literally. So, all right. And then Alex, again, we're going on the list there. It's too close of a shave downstairs created a lump that they thought was a hernia. So don't shave your testicles. All right. A lot of testicle stories there. So I talked about it before. I had a kid with a fractured femur, no contact, standing, playing soccer, making a move. Boom, femur was fractured. Required a rod and
no tumor though. I mean, because that's my first question was, is there a tumor because of non-contact? But
no, I didn't.
You'd see it in the X-ray, but I mean, so
I didn't ask that, but they didn't say anything about it. So, all right, Woodford, CEO Sports Medicine, said they had a soccer kid with a tibial plateau fracture. They stepped on a ball to make a move, slipped, and felt a pop. All right, so it seems like after J.J. Watt broke his tibial plateau fracture, that it's come up a whole lot. I mean, obviously it's happened before, but is this something that's newer?
No. It's common. It's not as, it wasn't as mainstream until JJ, where people understood, heard more about it. I know when I was with Dr. Lowe, we probably had 1 or 2 a year that he would fix. So, I mean, not that many, but enough. I mean, one was a softball catcher got taken out and, fractured her tibial plateau, similar to JJ, but hers was sliding into the plate versus him just loading his.
Mm-hmm.
So, but yeah, it's pretty common.
So I don't know who it was. I was having this conversation. Do you feel like athletes like JJ Watt their muscles are too strong and their bones can't adapt to it and handle that? Or their ligaments or tendons? Well, probably not their tendons, but the ligaments.
I'm not going to just say it's JJ. I'm going to say my personal opinion is I don't think in the world of human performance sports medicine that we do a good enough job. We create these bigger, faster, stronger athletes. All right. So we hypertrophy in our muscles. Our ligaments aren't getting thicker and stronger. Our articular cartilages aren't getting stronger. Our bones, to an extent, get stronger because that's a stress that's going to, make a response to the bone. But at some point, something's going to give. And my for instance is, again, when I was working with Dr. Lowe, we had 2 ACL patients that tore their ACL from nothing more than kicking at a ball and missing. And the quad contraction alone created the anterior translation with enough force to tear the ACL. Okay. So I think JJ's a big, fast guy. If you look at that on film, it's an ACL mechanism, but his bone gave before the ACL did for whatever reason. I don't know. I mean, it just happens.
Right.
Look, Tim Crumry in the Super Bowl 20 plus years ago had a spiral fracture on his tibia just from trying to cut, and you can just see that sucker flopping in the breeze. But I mean, it happens, But I think we got to go away from making bigger, faster, stronger, and get into making better athletes. And I think better athletes is probably a more supple athlete, a more balanced athlete, where they've got movement, agility. They can function. It's not just some big, thick meathead of a kid that, they can lift a lot of weight.
All right. So a similar injury happened here. I had a athlete tear the ACL, but when they went to the doctor, they went to surgery, and they was like, "Oh wait, your ACL is perfectly fine. It just avulsed where the ACL was attached to the tibial plateau,
tibial spine."
Yeah, so they just reattached it there. Athlete seems to be doing well now, and is just very anxious to get back to sports and things like that, because it seems like that heals pretty fast.
Yeah, because the ligament's intact, so it's just you're just repairing the avulsion fracture.
Basically a matter of bone. But on that, doctor said that the athlete won't be able to run this year, so not until next year will the athlete be cleared to run. And this happened probably, I would say, December. So until November is about whenever the athlete was going to be cleared. So again, about 11 months there.
I don't know. I mean, I don't know. There's so many things that go into that. Was there anything else damaged? How well did it go back when it was put back on? I mean, because, sometimes you avulse it and you're missing some pieces, so there's too many factors at play to say, yeah, that makes sense or it doesn't, who knows?
Yeah. And it's hard to explain without being specific, because, we want to keep the generalities here. All right. So again, Woodford Sports Medicine, so talking about the tibial plateau fracture, they said that they saw blistering instead of a fusion and knew it wasn't a normal knee injury.
Fracture blister.
A fracture blister? All right. So I'm ignorant. What is that?
It's just one of those signs. You see blistering like that, you just think fracture. I don't know what causes it. It's just one of those things. One of those pearls I was told, if you see this blister, think fracture.
So it looks like a blister, like a sunburn blister, or like a bottom of the foot friction,
like a sunburn blister, like a burn,
like bubbling
just
on the
bubble
skin.
up. Yeah.
Does that also happen after surgery? Because I had one of my kids with ACL, but he also had like 3 other things fixed too. I think he said he had some blisters on his skin after that.
Yeah, you can have some just from some of the swelling, different things. Yeah.
Interesting. I have learned something new. All right. Mike Copper, always active on social media, had a football player with a bug fly through his ear hole of his helmet and into his ear. The head AT and the team doc couldn't get it out of the field, and they referred him straight to the ENT, who ended up having to put the kid to sleep to remove the bug.
I had a kid cut the lower part of his earlobe on his helmet one time. He put his helmet on and his earlobe was curled up, and he got hit or something, and it cut it right there, and actually had to just get excised off. Couldn't spare
like
it.
Matt Schaub.
Yeah, pretty much.
Get his helmet ripped right off. So that's
had a kid swallow a safety pin. Now that I think about it,
swallow a safety pin.
It was open.
What was the course of action for? Did they drop a magnet down his throat or something?
No, they just
let him go.
You watch it. They went to the ER, but you watch it. Yeah, I'll leave it at that.
You just watch it. Did he have to stay home? I mean, did he have to stay in the hospital until it passed?
No,
you just have to watch for it, huh?
Yeah.
Don't swallow safety pins, Adrian.
Don't put crap in your mouth. You don't need to put in your mouth.
All right. My wife is terrified of spiders, and I read somewhere once that you swallow an average of 8 spiders in your lifetime, like while you're sleeping.
Really?
Yeah. And so this right here, we got a bug flying into your ear and you're requiring surgical removal or being sedated.
Is she listening today?
I don't know. She may be, but
you're probably within 6 feet of a spider at any time. So just FYI.
There you go. I know. So I tell her, I was like, spiders eat mosquitoes. I hate mosquitoes. Spiders don't really ever bite me. So, all right. Any of you guys got any stories? Think of them. You do? No? You got a story? What, yours? Is it strange, interesting? About the ACL? Yeah. Well, we're talking about like just weird stuff that's happened. So, I mean, you could step up and share if you want to. Well, you got to come over to the microphone. Come over to the red one here. All right. All right. So Lewis is going to share his story about ACL. Go ahead. You got to come up close like I am.
All right, so
You got to come up close like I am.
All right, it was a football game, and I was playing against Belair. I was playing outside linebacker, and I saw the play come at me, and the lineman was blocking me. And when I planted, my knee popped and shifted, and the trainers came in and examined it and stuff. And when I was trying to walk out the field, I just felt my leg was wobbly 2 pieces.
So I've never torn anything like that, and so it's interesting to see. Right when you did it, did you like? What did you think? Like right when it happened,
I can't play anymore.
so you thought you're like,
Yeah.
"Oh, I'm done,"
Yeah.
or you're like, "Man, something feels weird," but you were like, "Oh, I'm done."
'Cause it popped and my knee just shifted.
Did you think, "Oh, it's broken"? Or do you think, "Oh, it's torn," or you just knew something was wrong?
Something was wrong.
Got it. All right. So anything strange happened as part of the surgery recovery?
Nope.
No. All right. All right. Well, we'll continue down our list. I think we're going to do just a little bit more, and then we're going to cut this one off. So you have a nice little 30-minute weird stories podcast, and then we will continue again with some more. So this is possibly my favorite story, my favorite response out of all of them. Daniel Isley, which is EASLEYATC on Twitter, said he had a kid sprain his ankle while taking a nap on the couch. So it was between football practices. Kid apparently rolled over in his sleep. His foot was caught between the pillows, sprained his ankle, ended up being put in a boot after going to the doctor and quitting, not playing that year and quitting football because he hurt his ankle taking a nap on the couch.
Well, that reminds me, I had a kid pull his hamstring while sleeping, and brought me a doctor's note as such. I don't know. I thought you're supposed to be relaxed while sleeping.
And did you ask for details? I mean, what's the deal there?
At some point, you just shake your head and move on. So I'm like, "Huh?" And he goes, "Yeah, I was sleeping and pulled my hamstring. I've got a doctor's note." Okay. So.
All right. So
That's me.
that's just, don't end the live stream. Okay, just leave it. Just leave it rolling. Just leave it rolling. All right, so we're gonna end this one right here. It's a nice quick episode, but we're gonna come back. So this is sportsmedicinebroadcast.com/war stories. We're gonna pick back up with sportsmedicinebroadcast.com/war stories 2, where we share some of the stories that athletic trainers have seen, weird stuff they've seen throughout their careers. So one thing I would ask is, if you're going to NATA in 2018 in New Orleans, then come find me. I'll be at the podcast booth, the podcast lounge. All right. And so me and Rob are kind of co-hosting, and we'll be there the whole time. So come find me at the podcast lounge there at NATA convention in New Orleans. So Bubba on Twitter is ATCLAT Bubba. And then obviously sportsmedicinebroadcast.com is all the ways to get a hold of me. So
I'll come hang out with you at NATA.
Yep. So Bubba will be there too. Kathy will be there helping out. So come find us. Let us know. Come be a part of one of the shows, maybe even get a free t-shirt. So come meet us at NATA in New Orleans. And that's a wrap. Anybody else got any weird stories, like stuff that's happened? Do that.
You know what they told me when I got X-ray on the problem? I couldn't kill myself because my arm was happening.
Really? Was it poking through the skin?
Yeah.
Like it broke the skin? Yeah, you land on your shoulder. Just pushing up. But like, what I'm saying, like, did it cut your skin? No.
I like reading these because it reminds me of other stuff I've forgotten about that I've dealt with.
Press the red button, Maria. The red circle on the screen. Alexa, you can switch between the two if you want. All right, here we go. We're coming back for sportsmedicinebroadcast.com/war stories 2. I've got Bubba. So we've just went through, Bubba shared some of his strange stuff that's happened. We're going through this list of responses that I got to a question on Twitter. Again, the question is, what's some weird stuff you've seen? And there was like 60 or 70 different answers, and some of them were really good. I would recommend checking out the last one there that we just talked about on War Stories 1. So sportsmedicinebroadcast.com/war stories 1. Of course, I'm your host, Jeremy Jackson. I've got Bubba Wilson, and then one of my students, Lewis, he's sharing some of his stories. So Lewis, let's try this one again. All right, pull the mic down for you. There you go. So make sure you're up close when you're talking. All right. So Lewis was telling us he playing street football or football in middle school, whatever, landed on his shoulder and had a displaced clavicle fracture, not a open, but displaced. So tell me just a little bit about the story.
I was playing football at the park with my friends, and I tried jumping over someone because he had tripped and hit me in my legs, and most of my weight landed on my shoulder, and I heard a crack, and my collarbone overlapped, and when I got the x-ray, doctor said I could have died because they almost stabbed me on my neck.
All right, Bubba. We weren't there. We didn't see the x-ray, so I'm not questioning the doctor, right? So this is not completely our situation. But how real do you think that threat is?
It's there. I mean, there's a lot of bad stuff behind the clavicle. So which way did it displace?
He said it displaced it up pointing towards his jugular. So
Yeah, I mean, but where on the clavicle was it fractured? I mean, who knows? So,
right. And so I've also heard of clavicles being fractured and puncturing along, like going down and puncturing the lung. So that's something that's very serious. Or like cutting the muscle here, the pec. Now, one of the coolest things I ever did was I went with Dr. Crumby, and I saw him set a clavicle from one of our injured kids. And it was brutal because that stink of burning flesh when he does that surgery, it was like I almost seriously passed out. But just seeing him go in there and cut that away, and pull it up, and using a drill and literally drilling a piece of metal right there into the kid's clavicle, like that was one of the coolest things that I as an athletic trainer I've been able to do, is just seeing those surgeries. It was a really cool experience. So thanks for reminding me of that there, Lewis.
I had a kid dislocate his shoulder during pregame form tackling. So my first response is your form sucks, obviously, with my sense of humor. That's a longer story for another time because there was more to it than that. Also had a non-contact tibia fracture from a quarterback running down the line of scrimmage to run the option and planted to cut up field, and was like he got shot by a sniper and ended up had a tibia fracture that had to get fixed. I like reading these and hearing them because I'm like, oh, I had this too. I remember more stuff all the time.
Yeah, see, I knew you would. All right, so Geeky Athletic Trainer, which is at Geeky at ATHLTRAINR. Right. So if you just on Twitter, Geeky Athletic Trainer, so you had quite a few responses there. And some really interesting ones. There was a volleyball player that accidentally severed her radial artery trying to get net poles set up. So in volleyball, setting the upright poles, severed her radial artery. So I was like, how does that possibly happen? Because I'm trying to think through the process. So I asked for an explanation, right? All right. So real quick, I'm talking to my students here. You guys know where your radial artery is? Where's your radius? Where's your radius? Right, thumb side of your forearm. Good. So it'd be somewhere right along the radius, right? All right. So the radial artery. So what happened is they had just redone the floor. So the varnish or whatever had sealed the holes down where the volleyball poles go. And somebody thought using a pocket knife to dig those up would be a really good idea. So the volleyball girl is using a pocket knife to dig the flaps up on the floor and just slice that artery. And let me see. Yeah, I don't have all the details of like what happened, or if they called 911 or
we could. Once you said knife on the floor, it pretty much seals the deal right there of what happened.
Yeah. I think everybody knows that I love my wife. I absolutely love my wife, but she was trying to take this seed out of an avocado and she had
Yes.
stabbed it to pry it out, but it slipped, and so then she cut like her thumb right here. So she didn't cut her radial artery, but she cut her thumb open on Father's Day. And so I just think of that like, that is such a bad idea to try and stab this round
Don't you
slippery
know you're
object.
supposed to go long ways with the knife? Right there?
Well,
She does now.
I don't know what happened. I was outside barbecuing, and her mom came out. Jeremy, Sarah needs you. She just cut her thumb off, I think is what she said. But go in there, like, okay, well, we need to rinse it out really well, and we'll finish eating, and then we'll go get stitches.
Yeah.
And that's
We
pretty
don't
much
want to ruin the meal. You can wait. You're all right.
That's pretty much what happened. I was like, we need to go get that cleaned out because it was a food product. And anyway,
Rub a little dirt on it.
so be smart when you're dealing with knives. All right. So a soccer player tore the ACL dancing, again from Geeky Athletic Trainer, the LCL dancing. I've heard of people tearing ACLs twerking
Yep.
before.
Yep.
Yeah, Adrian is twerking right now. So I don't even know how that, whatever. I guess it just happens. But this one was really strange. The Geeky Athletic Trainer said they had lockers collapsed on a soccer player, fracturing her hip 5 different places. And so like essentially what happened is like somebody leaned on the lockers and then they just fell over and fell on top of this girl and fractured her hip. Like it was, I don't know, crazy. So you just go in there to, again, the locker room, and you got a kid with the 5 different hip fractures. All right. Have you ever seen a scapular fracture?
Yes.
Tell me about it.
Quarterback got sacked. And I mean, it was pretty, just that I've got pain on the backside of my shoulder, and it went, palpating like, get an x-ray and there it is.
Okay, so
nothing too sexy in the grand scheme of things. I mean, just hurry up and wait.
All right. So tell me a little bit more, like, did you think that there was a fracture right then, or was it like, okay, well, the pain's not going away, let's get it checked out?
Yeah. I mean, they've got decreased strength. They got decreased motion, obviously, because anything you do, raising your arm, your scapula is involved. And, so they couldn't play, right? They couldn't raise it and throw it. So we waited, and it was just tender enough. You're like, it's a weird spot to have, tenderness with palpation. So let's go see what's going on.
So again, this like a normal sign is point tender over where the fracture would be.
Yeah.
Right there. Decreased range of motion, swelling.
Yep.
So very interesting. I don't know that I haven't ever experienced one, but it was this story from Geeky Athletic Trainer is kind of the same thing. The quarterback landed flat on his back, fractured the scapula.
Yeah. Ours was sacked, same thing, lands on his back.
All right. So how do they treat that?
They didn't do anything with it.
Is it like an old clavicle fracture where they put them in
put them in a sling?
A sling and just let it heal?
Yeah.
Now, was your your scapular fracture like a complete or just like a partial?
It's just I think it would be an interesting question. I'll ask one of our guys, but I think if it's complete, depending, they may actually go in and try to
screw it back together.
Put wire or something in there. I'd have to ask. I don't know how they would do that, but it healed up. They just put them in a sling. So there was a line in there. I had a humerus fracture in college on a receiver that was blocking, and he was blocking a defensive back, and somebody fell into his arm, fractured his humerus. And the interesting thing was he's laying on the ground, and it was on our sideline, and our team physician just stepped out and reduced it right there, set it right there, and then walked him in for an x-ray. So, but you could just see it, and then he just goes.
Yeah, well, there you go. That's kind of what we were talking about before we started the show, or at the very beginning of the war stories. Was that the reduction? Every physician I've ever seen or ever heard from said reduce it right away if possible, within 1 or 2 tries. So there you go, just right away, boom, reduce the damage, reduce the swelling, reduce the pain. And if you're an orthopedic surgeon, that's what you do. So either do it now or do it a couple hours later in the OR. So very cool. I remember in high school seeing the first dislocated elbow. It was kind of the same thing. Somebody fell on their arm extended, and so then we didn't have. I don't think we had team doctors on the sidelines back then, but I actually saw Dr. Crumby reduce one on the sidelines of one of our kids.
I remember that one.
Yeah, he actually couldn't get it, and then like when the kid went to stand up, they had just the right amount of tension, and it just like thump, popped right back in place. But kid ended up, I think, wearing a brace and playing the rest of the season. So
the ones I've dealt with have been in wrestling, and no physician around, and they didn't want me to touch them. Leave me the bleep alone. I'm like, that's fine. Let me at least make sure you've got a pulse and feeling, and then I'll send you to the ER. But I was almost begging them, come on, let me help you out. No, leave me alone. Don't touch me. All right. Let's make sure you got a pulse and, all that. And then, Mom, here you go. Have a good time.
So the wrestlers just didn't want you to deal with it.
Mm-hmm.
And
2 different ones. And
was this when you were working at a school or through the hospital?
School.
So like you were supposed to be the athletic trainer there on site working with those kids. Were they your kids or visitors?
1 and 1.
One?
Yeah.
Really?
Mm-hmm. Don't touch me. That's fine. That's fine.
Hmm.
Let me just check the bad stuff. Then that way I can give them some information. So
it always makes me think of there was a kid, like just almost any time, like if I go to touch a kid, like, hey, they know who I am, right? So it's my kid. So I go to evaluate them and they hit at my hand. I'm like, if you hit at my hand again, we're either going to call the ambulance.
Right.
Or you're just going to just lay here by yourself. Right.
Yeah.
So I'm not going to check you out while you're hitting at me. Right. You're not going to do that. And like, it's just, that's just not going to happen. But I don't know that I've ever had somebody like, no, don't touch me. Don't touch me. Don't touch me.
Yeah.
Usually once I say that, they're like, okay, fine. Yeah. But
that's fine. If you don't want me to touch you, I won't. You don't want me, don't mess with that. That's fine. So I just, let me check this stuff. We'll put you in a sling and Mom can take you, and that, everybody's happy.
All right. So a quick show of hands here. Who thinks, or who do you think this is most like? Is this most like Alexis or most like John? Somebody had an allergic reaction when the football player wore a dirty girdle he found laying on the locker room floor because he forgot his. So is it more like it's more like John? So John's gonna end up with an allergic reaction on a girdle.
I want to know. What I want to know is this a freshman or not?
I don't know. I don't have those details. So that's from Jenny Williams, which is SJWATC on Twitter. So you could
because
tweet at her and
that right there is why football players get the moniker of being stupid, and that's also, if it's a freshman, why they deserve the term of stupid freshman.
All right, so real quick, my girls in here, do y'all know what the girdle is? It's basically like the long underwear, like they put on and the pads go in now, like they'll put the thigh pads in. So not the pants, but it's basically like underwear. So this dude apparently found somebody's underwear laying on the floor.
And it was in better shape than his, I guess.
Yeah, well, he couldn't find his or something like that. And so that's disgusting. That's disgusting. All right, Megan Marcel, which is Megalo, Megallo on Twitter, said she worked at rodeo and the bull stepped on the guy in a place that no guy wants to be stepped on. So when the boss went out, the guy came back and said, yep, they're out of the skin. So the guy's testicles are hanging outside of the sack. And then the guy didn't even want to tell anybody because he didn't want his girlfriend to freak out. So he drove himself to the hospital with his testicles hanging out of the skin. Now, I would think that Megan is making up this story, but after working the rodeo just like one night with Sean, I'm 100% sure that is
I've
accurate.
got about 4. We won't do it on this broadcast, but there's about 4 stories from the rodeo this year alone.
Yeah, I mean, I've told some of y'all guys about the bull stepping on the guy, him being unconscious, and then him driving himself home for 4 hours away because like he repeated the same story like 10 times within an hour, and those guys are nuts. But just know with your ACL injury, Lewis, your testicles could have been hanging out of their sack and you didn't drive yourself to the hospital. Just know that. The guy's tougher than you. All right, so Megan also said oh no, she was saying something else. That was her first time working the rodeo, so quite an experience. And again, maybe next year if I take kids on a field trip again to the Pasadena rodeo, I'll make sure that they go for the injury part, for the rodeo part, and that way they can actually see some of that stuff. Because
Well,
It's hard to believe.
how do you get the guy working the barrel? How do you get him out of there when he's unconscious?
Were you there for that?
No, but
Mm.
just think about it. You know,
Yeah.
it's a different world altogether in what you deal with there and what you got to think about.
So did you ask how they did that?
I know how. Well, basically, he woke up eventually and got out. But I know of one that was had a C-spine that was in the barrel, and they basically got a backboard into the barrel
No way.
and slid him out. Yeah, but also, what do you got to think about all kinds of stuff. We need to go out there and take care of this rider, but the animal's still in the arena. So
Mhm.
you're not going out there with the animal still in the arena or the animal unsecured in the arena. So there's all kinds of things in rodeo that you never think about until all of a sudden you go, hadn't thought about that. You know, it's a different world. It's a different sport altogether. And not just in getting stepped on in certain places. You know, you as you learn, I'm fine. I'm driving 4 hours. I want to go home. Okay. You're an adult and this injury isn't one we can force you to go to the hospital for.
Crazy stuff. I recommend any athletic trainer volunteering to work a rodeo in your area as part of the sports medicine team and just to see the craziness that is rodeo athletes. All right, so we're going back to Woodford County Sports Medicine. I think that's what the CO means. Woodford CO Sports Med. They had a state wrestling, and a kid was kicked in the jewels, and the swelling ensued. Seems to be a lot of
testicular
stuff.
stories. Yeah.
Yeah. So they had to go to the ER and have the scrotum drained.
That's cringeworthy.
Yeah, that is no fun. And so getting kicked hurts enough, but then having a needle stuck in there, I guess at that point though, it kind of felt good because all that pressure, all that swelling in there. So having it drained probably was a relief. All right, Miss Kimmery, which is KJ Sigmund on Twitter, had a b-ball athlete with not one but two spontaneous pneumothoraces in 2 years. And
Nice.
so, yeah. So, what are your thoughts there, Bubba?
I have none. I mean, I'm just thinking, really, you know.
Yeah. So I think she said they ended up finding that the kid had a family history of something like that.
Yeah.
And then I think you said one in 2 years. Yeah. I'm forgetting all the details. All these stories are getting intermingled, but yeah. I know what it was. It was a cultural thing. So the athlete was of a culture that something like that might be normal.
Right.
And she messaged me
not
privately.
normal, but more prevalent.
Yeah, she messaged me privately, so I don't know. I don't think it's okay to share. Otherwise, she would have put it right on Twitter. So, all right. So we're gonna go ahead and wrap up War Stories 2 right here with that, and then we'll come back in a second. So again, this is sportsmedicinebroadcast.com/War Stories 2. So continue along with the story with the interesting stories from the athletic trainers. Again, sportsmedicinebroadcast.com/War Stories 2. I'm Jeremy Jackson. Bubba on Twitter is ATCLAT Bubba, and you can find us at NATA convention at the Dragonfly Max booth. Come and visit us. That's a wrap. Leave it live. Leave it live. Leave it live.
Hey, scroll up just a little bit on that. We won't. No, the other way. Perfect. Perfect. Okay, Jeremy, go back to where you were. I was reading ahead on the one from Lynn's.
All right, here we go. I know the live stream is continuing, but we're going to, again, we're starting the recording. So in 3, 2, 1. What's up, y'all? Welcome to the Sports Medicine Broadcast. I'm Jeremy Jackson, your host. I've got my buddy Bubba Wilson. We are talking about athletic trainer war stories. So Bubba shared some of his in sportsmedicinebroadcast.com/war stories. And then we've been reading tweets to responses to a tweet that I got in sportsmedicinebroadcast.com/war stories 2. And this one is war stories 3. So I would recommend going to war stories 1 and then working your way through. But we've done it like this so that these things can kind of stand alone. Hopefully it's like a shorter podcast. You just get to laugh, you get to learn a little bit. And then you hit us up and tell me what your stories are. Maybe you didn't get to share them. So sportsmedicinebroadcast.com has the ways you can get a hold of me. You can tweet, Facebook, email. You can call and leave a voicemail, I think I have on there. And then I could play the clip on here. So check that out, sportsmedicinebroadcast.com/war stories. And this one is War Stories 3. All right. So Mike McKinney. Mike is a good friend. He lives in Boston. He let us come over to his house and eat dinner. I've talked to Mike a couple of times on the show. A really cool dude, really smart. And so he responded and said he had a track athlete with a double ankle sprain. All right. So the athlete sprained their ankle and then was hopping around to avoid putting any pressure on that ankle, and then ended up spraining the other one. And I can only imagine.
You know, if you look at it, I mean, that's not uncommon, but at the same time, probably one athlete a year in middle school that falls down and has bilateral forearm fractures. You know, that's pretty common too. I had an athlete, high jumper, avulsed their sartorius while trying to high jump. And the fun part of that was trying to get them out of the high jump mat. We ended up having to scoop stretcher them to get them out, to get them to the hospital. You're running around like a madman. Yeah.
All right. So actually, now that you said that, middle school athlete with the bilateral arm fractures, I know there was somebody in this district recently that had that, just playing basketball, run into the wall, put the arms out, boom, and just snap both those arms.
Yeah.
And that's a reason you need to have athletic trainers in the middle school. So that's a whole different podcast that we've done. So check those out. There's lots of times I've talked about that, and something we're still working on. All right. So again, the double ankle sprain, is that the athlete, his teammates were laughing at him. And of course, me as the athletic trainer, I would have been laughing too. Like, dude, I don't even know how you do this.
I think you're unconscious if you're not laughing.
All right. So continuing on down the list, Linz, which is Linz M Babe 21 on Twitter, LINZ MBABE 21, said she had a kid go in for shoulder surgery and come out
complaining of mild shortness of breath.
Yeah, so mild shortness of breath, and the nurse said it was from a nerve block. The next day they brought him into the ER for a punctured lung.
Had an athlete have ACL surgery, normal, healthy 21-year-old, no history of anything, and came in and had bilateral pulmonary embolisms, had blood clots in the lungs with no risk factors, family history, nothing. So that was kind of crazy.
So the ACL, and then they had the bilateral embolism.
Mm-hmm.
You know, an athletic trainer that I know recently, no history of blood clots, embolisms, and was flying from here in the United States, you know, just a couple hours away, flying back here. So then was put on basically bed rest for a couple of weeks because she had blood clots. They just, I don't know, just, it's so strange. Just random stuff you have to deal with there. All right, so Lynn's continued on there saying, yes, there's a small puncture leak, and the lung was at 50% when they did the chest x-ray. All right, so we got Tiffany Evans, TK Evans 506, had a femur fracture, kid from a visiting team with no athletic trainer. On the way to the ambulance, he straight-faced asked asked her if he could play the next week. Oh, I love those where I can't even finish reading this reading it out loud because it's just I know that happened. Like I can see it happening.
Well,
You
the
just-
only thing missing is the coach asking. You know,
Can you go? Can you go? I need him to play.
big game next week. Is it going to be okay?
All right. Megan Melanchak, Mega_Tron22 says she's been inspired by some of these stories. Had an intern working with football get trucked during a scrimmage and get a trimalleolar fracture.
Nice.
So, all right. So, what is trimalleolar fracture? Fractures the malleus in 3 places. Oh, Bubba
I'm not
needs
going to be able
water
to
too.
talk it through. So
All right, so we'll continue. Bubba will be back in just a second. And then a separate incident had a wrestler get bilateral meniscus tears during the same match. So I don't know. I can kind of understand the meniscus tear if it was like associated with a knee dislocation or something like that, but that just seems pretty crazy. So, all right, what's the trimalleolar fracture? No. All right, so Bubba is out of commission for right now. All right, so we went back to Geeky Athletic Trainer. Says they had a wrestler trying to get revenge for a concussion a previous year on the opponent, broke his radius and ulna, and then his mom went into shock. So trying to get revenge, you end up breaking both your bones of your forearm, and then your mom passes out. So that's something we talked about recently is just the parents trying to rush down there and be involved and then passing out as well. And I think I shared the story of whenever Sarah had our second son, it was so fast. And like, I could see that like, it was just so much pain and, everything was just happening. And I was like, oh my goodness. I almost passed out like right after the doctor caught the baby and handed it to her. I was like, I got to sit down. Yeah.
I don't think he listens, but I've got a buddy that had a starting running back tear his meniscus having sex with his girlfriend. So I'll leave it at that. The rest of the story is off air. But talking about the parents, we were playing here at Pasadena and had a kid get lit up on opening kickoff. And I go out there and I'm talking, it's a concussion. I'm talking to him and you can hear this gasp. And the mother was freaking out and wanting to come see her baby and tried to go over the rail and fell flat on her back on the side right there by the wall. She just splayed out right over there. So needless to say, we beat her to the sideline of her getting up. But yeah.
Nice. All right, so Geeky Athletic Trainer again saying a friend's husband complained of calf soreness from bracing her legs the day after she gave birth to twins. Yes, so it kind of changed to pregnancy stories there, and that's no joke. I do not envy a woman in giving childbirth. That just wreaks havoc on your body. So Vonnie VONNIEATC said they had a kid with a pacemaker, and so that's actually something I think 2 or 3 people said, or I've heard a couple times. Have you ever experienced a kid with a pacemaker?
Mm-mm.
And yeah,
I had a football player with one kidney, which was shocking that they allowed him to play, but he played offensive line. So your risk is lower there, but still, but I've never had one with a pacemaker.
so somewhere on here, well, I'm sure we'll get to it, but someone said they had a kid with a fractured kidney. So where it actually like busted in 2.
I know who that is.
And then they ended up, the kid was, I think, played soccer the next year because they, didn't want to go back and play football. When I was in high school, a friend of mine had a ruptured kidney playing football, and I know he was out for a couple weeks and it wasn't able to return to football. But yeah, craziness. So I need to find out more what you would do on a kid with a pacemaker, like what special considerations. So if you know how you would treat that, how you would do things differently, special considerations, special things you need to look for on a kid with a pacemaker, then let me know, and I can include that there in the show notes. If you have kind of a document or a handout, something like that, then let me know there. All right, moving on down the line. Ron Linfont.
He's old.
He's old, you know, Ron.
No, I'm just reading it. Just he dates himself.
I'm sure he's going to appreciate that. All right, so the first game as a student AT covering a high school football game by himself, which is not allowed anymore.
Different time.
When within the first 15 minutes, they had a concussion of the QB, which, again, I mentioned there that back in the 70s, there wasn't a concussion unless you were unconscious and couldn't get yourself up, you know, within a reasonable amount of 10 minutes
But you
or
still
so.
went back in the game.
Yeah. You got 5 minutes later. Are you okay? No head hurt? All right, go back in. They got a dislocated hip in the tailback and then a dislocated shoulder with the fracture of a clavicle, all in a game as a student. And, you know, Bill's kind of took over my coworker here, the sports medicine responsibilities as like a middle schooler. And he tells me stories about having to like basically make medical decisions as like a freshman, sophomore about these high school athletes when he has no more training, really just slightly more training than the coaches and dealing with injuries.
Yep.
And, you know, that's the way it was back in that time. And that is crazy. So yes, please don't leave high school kids by themselves with to evaluate injuries. That's illegal. Tanya McKinney, Tanya TANIAMCK, says that a football player down on the field with concussion, when they asked if he knew where he was, he said on the grass. Yes, that's good. So technically he was right, but we continue on going right there. Matthew Boyne, sorry, Matthew, MBOYNE 918 says they had a one time where he asked the athlete what happened, and all he would say, well, what Yale really was, Gerber baby food is good for everybody.
He's Batman.
He's Batman. Have you ever had Gerber baby food as an adult?
No, I try to stay away from it. I had a concussion. You go out there to get him, and he's watching cartoons. You can just see it. I mean, lights are on and nobody's home. So we're walking off the field, and you know, typically the PA guy will be like, you know, so and so, you know, and everybody claps and does all that thing. So we're walking off the field, and they say his name and his number, and it said, okay, so and so, number 81. So I just asked him. I said, hey, what's your number? And he thought for a second, looked down. He said, number 18. And I just lost it at that point. I'm like, you know, if there was ever any doubt, that ended it right there. And there was no doubt to begin with. But and his mom's at the round. She goes, I guess he's okay. And I said, well, yes and no. She goes, what are you laughing at? And I told her, and she just shook her head and just walked away at that point. She's like, oh, he's out of it. I said, yep. So I just found that funny. Like, you know, he's like, what's your number? 18.
Mm-hmm.
So close enough.
Close enough. That'll do, pig. All right. So then going back to Tanya McKinney says you had one that never that never would have cussed in front of me, and so they came up to her and said, "Man, I just got knocked the f out," and then got the correct answer when she asked her name, but every other question after that was also his name. So kid got knocked out and then just kept repeating his name apparently every time he was asked a question. So Geeky Athletic Trainer, pretty active there on Twitter. So again, Geeky Athletic Trainer, search up and it would be easier to find than the actual Twitter handle.
Grant. That's a good one.
So Geeky Athletic Trainer said they had a friend named Katie got concussed so badly that she thought her name was Ashley for about 4 hours. So yeah, you just wonder if it was, you know, concussion or if there's something else involved. And so I asked that question, but she's like, nope, there was nothing else. No alcohol, no middle name, no sister named Ashley. It was just you really got jacked up. So I've never, you know, the weirdest one I had was I had a football player come. He's like, Jackson, I just got a concussion. I'm like, what? And this is, we weren't a very good football team, and the team we were playing was a really good football team. And so it was one of those things like, are you just trying to get yourself out of the game or what? And I think this was actually before the Senate Bill 82 stuff. And so it wasn't like if somebody suspects a concussion, right, you have to keep them out. It's like, well, let me evaluate you. Okay, well, apparently you don't want to go back in, so we're just going to keep you out anyways. But just weird. Have you ever had anybody come up to you and say, hey, I just had a concussion. Maybe in the last couple of years after all the
Yeah,
education.
but not before 2011.
Yeah. So it was so weird.
I did have one back before we were more, what's the word I'm looking for? Responsive and towards concussions and looking out for them. Where back in the day, the kid would ride back with the team, where now you would take them with you, if you're on a different bus. And so the kid had a concussion and rode back with the team. And by the time we get off the bus, the kids are coming to me saying, play along. And I didn't know what they were talking about until the kid came up crying and asked me if he was homosexual. On the way from the stadium to the school, the other athletes had him convinced that he was gay from his concussion. So, that this was way before our PC culture now. And so it was, even his mother was laughing at that one, that he was buying into that. So it was pretty interesting, the depths at which his buddies would go to jack with him when he wasn't all there. So,
All right. So this is the one that you were just kind of talking about.
Yeah.
Grant Bargender. It's BARGENDER_51 on Twitter, said they had dislocated jaw while yawning during a team meeting. All right. So then I asked, is that normal? Like, what's wrong there? And so he said, actually, the kid's mom had the same thing because they had a history of TMJ. So I can't, like, I mentioned that one to Sarah, and she was like, oh my gosh, don't tell me that, because that, she yawns, she'll show her jaw will pop. And so I think that's something that's always kind of like, oh no. And so now she knows that it is actually possible, which I never thought that would have been possible either. But
I've had 2 maxillary fractures in football. The first one, we don't know when it happened. But the second one, he got ear hold on punt return. And I'm not kidding. And I'll find the video and bring it to you one day to show you. From where he got hit to where his helmet stopped rolling was 15 yards. And as I'm going to him, I just glanced at his helmet to make sure his head wasn't in it still, going out there, like, because he got lit up. And both of them had to get their jaws wired shut. So, of course, for the next 6 weeks, they're carrying around clippers. I've got clippers, everything that goes with it. But yeah.
clippers.
So if they ever start vomiting, you clip so they can let it go.
Huh.
So they don't aspirate, don't choke.
Interesting. We had a kid get punched in the face and end up breaking his mandible right up front. So he just got, I think it was just one good solid punch from a kid, and he had been instigating and just thump. And so like the kid was having trouble. He was bleeding there, and I was like, here's some gauze. You need to go to the doctor. And so at that point, I'm like, sorry, buddy, you're not an athlete. I'm not supposed to be treating you. I can do basic first aid. You got to go. Crazy stuff. All right. So Ray, amazing Rachel on Twitter, said she had a football player messing around on the blacktop, ran into a chain link fence, and basically scalped himself.
Ow.
Yeah. So that the face, the head, all that bleeds a whole lot. And so it went back. She said the scalp went back far enough on his skull that his eye started to swell and droop. But it was a really get the bleeding under control type situation until EMS arrived, and then we kept him awake and talking. So I can only imagine having somebody like scalped. You're just sliding. You see the skin peeled back, maybe even stuck on the fence still. Ugh. Anything crazy like that, Bubba?
No, that'd have been number 1 on my list if I'd have had that.
All right. We got Marcy Amelia Abraham. Marcy Amelia ATC says the same quarter of a football game, a kid had a kidney fracture. There you go. That's what I was talking about.
Different person. I know of another one here locally.
Wow. So like you said, it was split right in half. Then so they did eval the kid. Oh, in the middle of the evaluation, kid A which is the kidney fracture. Kid B goes down with what is called by a spinal cord contusion. And so they started to have signs and symptoms of shock about 20 to 30 minutes after the hit, which earned him a trip to the emergency department. Initially, thoughts were kidney contusion and a fracture of the ribs was possible. And after he was fairly stable and alert, and he tried to avoid me and was pretty adamant about staying to watch the game. At first, he was fairly stable. So that was the first time I'd ever heard of a kidney fracture before. What are your thoughts there, Bubba? How would obviously you got to have some imaging to be able to tell that for sure, but what are some of the things that when you look for on a kidney injury like that?
Well, I mean, it'd be flank pain early, but then it's, acutely after that. I mean, unless you start urinating blood right after, I don't know. I mean, that's, what are you doing the next day? I hurt back here. If you had any problems peeing, is that first question that comes out of your mouth. I think with the kid with the stroke changed some of what I do in that. At the time, I didn't have my blood pressure cuff and stethoscope and all that with me because I had a truckload of other things I was delivering. And as I jokingly say now, I don't go anywhere without it. I think, depending on how they're doing, you got to check those vitals too. That's important now, on all that. Just make sure they're not bleeding and, have an internal bleeding, you got issues. But to me, it's the pain. What's that level of the pain? Thinking about that, I had a kid take a shot to the ribs and dinged a nerve and he couldn't breathe, and they actually had to give him some medicine in the hospital to help him out. But, that's just one of those, that tough kid that can't catch a breath and couldn't catch a breath for, 15 minutes. And it's like, now we're gone. But that's the other part of it, which is easier for you guys in your role than me, is knowing your athletes. We pretty well in the high school setting know the tough kids versus the not tough kids after about 6 weeks.
Mm-hmm.
And so if I'm coming in complaining, shut up, it's something new every day with you, we'll get to you, versus somebody else coming in going, he doesn't complain, he could have his arm dangling there on the side and he wouldn't say anything about it. So that's a tough one. I don't know, how you figure that one out on the field.
All right. So I actually had opened this up. So if there was anybody wanting to call live, it looks like somebody's tried to join in the call. Hello, are you there? Nope. It's okay.
Bueller.
Yep. Hello.
Are you guys talking about Jesus the baby killer?
Jesus, who is this?
Jesus, the cult of the baby killer Jehovah.
All right. That's I guess I shouldn't put it out there for anybody to. Let me go ahead and.
That solves that. Well, that was interesting.
I knew I was taking a risk. in doing that. All right. Where were we here? All right. So Paul's. So it's KOONU 16 says a former doctoral student was talking about one time a chin strap got pushed upward and then ripped down, catching the bottom lip. So when the guy started drinking water, the area above the chin started filling up. So he had ripped the inner attachment of the lip from the mandible. You ever seen anything?
No, that'd have been top of the list too. That's pretty impressive.
Yeah, and so they didn't talk about how it was treated because they didn't know. Like I said, it was a story that he had heard. So crazy stuff. All right, Kevin Joyce, KJATC, said men's ice hockey player with a secondary chemical burn on his belt region sprayed Raid because he was showering. He saw something crawling there. So then Geek Athletic Trainer jumps in, crabs. We got crabs. And then Kevin says, yep, well, it says it's it's good for cracks and crevices on the can. So You can't blame them, right?
No, you can.
You
You
can?
can.
All right, Rachel's got a few. Rachel Blakeman, she's pretty responsive there on Twitter. So Rachel ATC, one athlete poked in the eye, busted all the capillaries in there, so it looked like a red spider web in her eye. 2, there was a distal tib fib fracture and dislocation with no contact. And then the foot turned completely opposite direction. So I've had 2 ankle dislocations with a fib fracture, but not a tib fib. And so I've never seen one turn completely around. And then number 3 was an athlete with a spontaneous pneumothorax. Number 4 from Rachel is a basketball player caught the ball on the tip of her finger, had long nails, and one flipped backwards up like it was hinged and avulsed halfway down the nail bed. Yeah, so I should have asked there, but if you have something like that, like I had a girl, volleyball player, just got nails and like it ripped halfway and it was pulling up on the nail bed. I was like, hey, you need to go to the doctor and get that cut off, because I didn't want to just cut it off there in the athletic training room, because I was like, that's going to hurt, right? If I pull that up and don't want to get infected. So she ended up just ripping it off and then put a Band-Aid on it and played. So, I don't know. Yikes.
No.
I know. That's why I try to keep my fingernails short there. That's terrible. All right. So then it said Rachel continues and said the head AT at her undergrad ran into the boards playing ice hockey and his stick got cut up under his ribs. So that evening he started getting weak and near passing out, nausea. And turns out he had his spleen. So playing ice hockey, messing around, stick got cut up under his ribs. So, I mean, I think that's painful enough already. All right. But then you end up rupturing your spleen. That's brutal. There was also a question, I think, on the Facebook group about playing in the faculty staff games, right? And so I always play. I'm almost 37 years old. I'm healthy. I work out. But, you hear lots of people about concussions or ruptured Achilles and that kind of stuff. And, I understand if you don't ever play sports or if you don't ever run around anymore, getting out there, then you're a lot more likely. But I guess it could happen anytime. Did you ever play in the faculty staff games?
No.
Why not?
I was there for the injuries.
See, yeah, usually if I'm not there playing, then I try to hide out so I don't have to deal with the injuries.
We would roll out the wheelchair and the AED for the coaches for that one.
But
we had a coaches versus seniors basketball game.
Yeah.
It got pretty competitive. So
yeah, that's about what we normally do, is the seniors versus the faculty kind of thing. And it's always fun. Like I said, I always try to play. All right. Alex coming back in. Again, Alex_day19 said the coach almost popped his eye out with a coat hanger, getting off the bus, and was super calm about having a piece of metal just hanging out of his eye socket.
No, thank you.
Yeah. Whew. I wish I'd seen the whole process. All right, what did you do? Did you put the gauze around it like they show you in the American Red Cross videos and bandage it and then snip it off and send them? Or, I don't know. Kind of one of those things I would like to see, but I'm not sure that I would like to see it. All right. My buddy Jared Plummer, Taping Pirate on Twitter, says he had an O lineman that had his hand caught between his face mask and the D line removes it when the. All right, so he had his hand caught between the face masks of him and another guy. When he removed his gloves, the distal tip of the finger stayed in the glove. So basically just sheared the tip of that finger.
I've had one of those.
You have?
I actually saw it. But as a DB, and he was going up and two guys were going to collide. So, he instinctively just put his hands up and his index finger got caught between the two face masks. And you just see the spray of red, and it just degloved that distal aspect of it off. And it's still deformed to because they had to go clean up the bone.
All right, so did that just deglove the skin, or did it pop the joint off?
No, the bone was still there. Bone was exposed.
Huh. Yeah, because I think what Jared's saying is the actual finger popped off. That's what I'm reading here. The end of the finger popped off. Yeah, I'll have to ask him, but I've never seen a de-gloving of any sort, and I'm not sure that I want to. All right, Rachel continues. Rachel's got lots of stories. Baseball player tore his labrum when he enthusiastically fist pumped, and then another baseball player subluxed his shoulder 2 times and tore the labrum when he was at bat in batting practice. Get a little too
That's
crazy
some
on bat practice.
Bad swings.
That's the people that are like me that don't swing, so you get excited when you actually have a chance to swing.
Come out of your shoes.
Yeah. I remember one time in college, the coach said, "All right, Jeremy, get in there." I said, all right. I'm not a baseball player, I'm just student athletic trainer out there. So I get out there. I think I missed like 80% of them, just trying to swing for home runs, just whatever. Surprised I'm still standing. All right. So this one is actually the picture that I'm using for the cover art, I guess, of this podcast is from Side Lake Sports Med. They had a collegiate hammer thrower bailed out of the throw and let the hammer swing around and slide through her hand to the wire. And then the end wasn't taped, and so that impaled her finger. I actually have no experience with hammer.
It's crazy. It's crazy. We did it. We covered the Senior Olympic Games in 2011 when they were here, and I was at track and field, and they let us play with the hammer and the javelin. The hammer throw is hard. I can see how that happens, honestly.
So I've never seen it. Again, I don't like track, and there you go. We don't have that in high school, I don't think. And so they continued somewhere further down. They give me the X-ray of this image. So the image there is pretty cool because you can see about middle of the middle phalange. So the wire goes in, and actually on the X-ray you can see that the wire is just shy of poking out of the distal
tip
aspect of that middle finger there. So pretty cool for us, just kind of crazy. And then again, long nails on an athlete there could have caused problems. All right, so continuing down the list, we got what's up doc _the_AT. Got about 5 of them here. Volleyball athlete had 2 doctors say a sty in the eye. The third one finally diagnosed her with herpes.
Nice.
All right, that could happen. The same volleyball athlete lost the end of the finger in a snow cone maker. All right, we got a baseball athlete had a ricocheted ball from a pitching machine bounce off the ground and cause testicular contusion that swelled to the size of a grapefruit. I mentioned that a couple years ago we had a kid get kicked, and same thing, super super swollen. And I see the kid walking down the hallway like he's riding a horse.
I think that kid deserved a wheelchair for a few days.
Oh goodness. So continuing on with what's up, Doc. There was a lacerated liver from a softball collision in the outfield, and
Nice.
then a kidney lacerated into 2 pieces from a football tackle. All right, Kevin Joyce coming back in. Again, it's KAYJATC. They almost forgot he had a hockey ref get his upper lip removed by a puck. So there was lots of blood, some great plastic surgery, and then you could barely tell that it happened now. So the guy's working as a state trooper. So the hockey puck catch you in the mouth and remove your lip. Woodford, lots of stories there. Coming back in, so we watched a linebacker run up and literally punt a long snapper's crotch.
Hopefully there was a penalty called.
Said it looked like he had Hada disease with bruising and swelling. Oh, goodness. Michelle Bliss said that they had a kid with a bad upper trap spasm from doing jumping jacks and warm-up.
They need to do a warm-up for their warm-up.
Right? All right. So we're going to continue on. We got Jenny Williams, SJWATC. Said there was a soccer player that broke his radius and ulnus jumping through a paper hoop on senior night, and a football player that got a cervical strain from shaking out his hair. So I asked her what the paper hoop was, and basically, like, it's a hula hoop kind of thing with paper that, they have the banners that they run through. And so instead of just walking through it, the kid decided to dive through it and then broke his radius and his ulna for the soccer player there. I don't understand how those people do that, the head banging stuff. Because, man, I start shaking my head for just a minute and, my head starts hurting. All right, so we got Miss Kimmery coming back in. KJ Sigmund had a kid bend over to tie his shoes, felt lightheaded and dizzy, took the vitals and set the example for the students, ended up with an uneven pulse, abnormal rhythm with oscillation, atrial fibrillation that needed a cardioversion. What's a cardioversion? Don't know.
He probably needed some type of cath lab procedure.
All right, so we got What's Up Doc coming back in. The most heartbreaking injury was a freshman football athlete that had a neck strain that was causing numbness along the right side of the trap and up the scalp and cheek. Told him that he needed to see the doctor. It didn't sound right and found out that he had brain cancer. And they ended up passing away after about 10 years of battling that brain cancer. So it's always tougher when it's somebody you know and you deal with rather than, somebody you just see once. So that's actually a great plug. Bubba's here talking about ATs care. If you have a situation like that, you have an athlete pass away or some sort of traumatic event, then reach out to the ATs care in your area, or you can tweet Bubba and he can point you in the right direction, telling you whoever it is in your area. I think it's a phenomenal service that the NATA has begun. So check out ATs care. If you just Google that, hit up Bubba, search my website for it. It'll be on there. So we got Ellie Larson. Ellie Larson says that she had a clinical site where dad decided to climb a chain link fence, messing around with his sons. Comes over asking for ice. He had a gnarly, shredded, deep cut. It was a hypothenar. They literally put 6 pieces of gauze on it, power flex over it, and told his wife where the nearest hospital was. Sounds about something I would do.
I dealt with a mom this fall at a volleyball tournament that was cutting up fruit and cut her finger, and she actually got, it wasn't completely gone, but got most of the flexor tendon. So, and it was her middle finger. So she came back in later after I got her fast tracked, and she came back in waving at me, so shooting me the finger for fun. But yeah.
So cutting fruit at the tournament or cutting fruit at home and then
at the tournament.
Oh yeah.
They were from out of town, so the kids were playing. They were cutting fruit. They were going to eat after, and sliced her finger.
Oof.
Not paying attention.
All right, Brady Course. Brady was on the podcast before, talking about a coach wraps tape around the wide receiver's head to stop a nosebleed. Go to rip the tape off after the match, and the kid's nose is facing his ear. He only screamed because they pulled some of the hair out. So yeah, I wonder if the coach just missed it, if it happened later, or what. I don't know how that happens.
They're not looking. They just know they're bleeding.
Stop the bleeding. That's the number one thing there.
Yep.
So, all right, Jenny Williams coming back in. SJWATC says you had a football player with staples. Football player staple into another football player's hand when asking the first athlete. Says, I told you I was going to do it. Number 2 says, but I didn't think you were really going to do it. Well, they're boys.
Once again,
they're athletes.
Stupid football players.
But I'm not sure. I'm not sure if I've ever told this, but I actually put my hand in a stapler once and just hit it to see what.
How old were you?
I had to be like junior high.
Okay, see, not like yesterday. So
no. I was like, man, that really hurt. That was really stupid. All right, Tanya McKinney, Tanya MCK, baseball player with a lacerated spleen after a collision at first with a positive Kerr sign, abdominal pain, and the running joke in college from then on was, I broke my spleen for every injury, ache or soreness the student athletic trainers had, but they followed it, but does your shoulder hurt? So that was a good reminder there, using the Kerr sign. You got hit in the abdomen, your shoulder starts hurting. So definitely prepared to recognize the injury.
Nice.
Yeah.
Nice picture.
All right. Mr. Dean, LAT, Mr. Dean 2017. Says a very large splinter at football practice. There's a nice picture here. The DE made a tackle that continued off the field and into the bushes nearby. They got up, found Mr. Dean, and said he needed his wound covered to finish practice. He didn't realize that there was something embedded in there. Luckily his mother was a doctor and removed it. And so you can't really tell by the picture for sure, but it looks to be like a almost like a piece of a pine cone or a piece of bark.
I'm going
mulch, like a piece of mulch.
It almost looks like bark mulch, but who knows?
Yeah, and so from the picture, it looks like it's probably an inch or two that it was embedded there.
People, you need to start putting the measuring tape down like they do at crime scenes, so we can get a better idea of.
That's what I'll do a lot of times. I'll put my shoe or my finger so people can like see the size of it, because then you have at least a reference. All right, so again, Mr. Dean apparently likes to take injury pictures because they had an athlete with a rope burn get tangled in one of the rope swings at a state park. I wonder if that was Garner. I like Garner. Garner State Park is awesome. Certainly an oddity. So again, you get to see the picture. There's like just a straight line across about the front of the ankle, and then with the normal wound care, took care of it. Michelle Bliss coming back in. The kid tore his ACL standing up from a couch and leaning over to give someone a one-armed side hug. Or at least that's how the story went, huh?
Yeah, so many comments.
You never know. It could happen. Kids do it dancing. Kim Schneider, Kimmy_AT. Twin brother defensive linemen tearing their right ACLs 1 week apart. The recovery from the surgery being so different between the two of them. So they had different PTs, and one of them had a little bit more stuff going on, but twin brothers tearing their ACL 1 week apart. That's pretty crazy. Reminds me of the movie The Notebook. You seen The Notebook, Bubba?
No.
It's good.
It's a chick flick. I won't see it.
You should watch it. It's good.
No.
Let me invite you over. You can watch it.
I'm good.
You sure?
I'm good.
We have it.
Appreciate it. I'm good.
Okay. All right. Shout out to The Notebook. And then I forgot to. So Kim also says that one that didn't lay. Oh, I'm sorry. You're talking about continuing the football injuries. Is that one that didn't play the following season, and the other one did. So PAWS pause, which is KONU 16, says personality wise. Oh, I'm sorry. It's still continuing on that.
Go to NCHS.
There we go. Here we go. NCHS-ATC says they were treating an athlete with POTS, and it was difficult to not be able to do anything but monitor symptoms and prevent not thoracic outlet syndrome. That's
POS. I don't know what
I don't know.
POTS is.
I thought I'd looked it up. I can't remember now. So I'll look it up here in a second. All right. And then Megan Chaffin and Selena Felton also commented saying they have experience with that as well. Megan Melanchek, Mega_Tron22. Also had a athlete give himself a concussion doing a pull-up. Selena said had an athlete with a concussion while taking a nap. I think we hit a bump or something on the bus, and I woke up with a really bad headache. I can definitely see that happening. Like we're about to go for a long plane trip this summer. I'm planning to sleep on the plane. I hope I don't fall off and fall in the aisle or something
Just
like
get
that.
you a neck pillow.
I'm going to. Actually, I already have it. It's in the closet. All right. Amy Struck, it's without a C, say STRUK. So on Gator Tape Girl. So Amy Struck, or Gator Tape Girl, had a volleyball player bust open her chin while doing the worm during warm-ups. Volleyball does the craziest things during warm-ups. That play chase or tag or doing the worm or this big old like line thing where they have to all roll over at the same time. Anyways.
And the next one's classic.
All right. So this one here.
Yes.
So she also continues, it was not odd, but funny. So the Ukrainian-born soccer player collided with another player on a header and had a big laceration on his head. As I put on my gloves, he said, "Yeah, you should use those because I grew up close to Chernobyl." Yeah, that's a good. All right. Grew up close to Chernobyl. I had I think it was Albanian. It was like some German area country guy playing, and he broke his arm. So it was obviously radial ulnar fracture, and he was like, yeah, my dad's gonna be so pissed. He would just tell me to just brace it and get back out there and play. I'm like, what the heck? Crazy. Different world. Daria Marie said they had a college basketball player, doctor diagnosed with raging cellulitis, was non-compliant with non-weight bearing after syndesmosis ankle sprain, and coupled with untreated athlete's foot, hospitalized for IV antibiotics, a boot, and then plantar fasciitis. So they didn't play for 3 months. Just follow instructions.
That'll teach you.
You ever had a staph infection?
Personally, no.
I did 3 times in college. I was playing, I think, intramural basketball, and I slid on the floor and scraped up my knee on the gym floor there. And so right where I scraped it, like it was super swollen. Ended up going to the team doctor. He was like, "Man, if you'd waited any longer, you'd probably be in the hospital with IVs." But then I had something else. I had something similar a couple other times in college. So I promise I wasn't putting on dirty girdles like that one kid. All right, we got Melissa Robinson, ML Adams 73, had a college track kid going to half-speed hurdles, sustained a spiral fracture of his femur. Oh, spiral fracture. Damon Amato, there's a preseason football camp in the woods, 30 minutes from the nearest hospital. Had 1, a shoulder dislocation, 2, an unhappy triad, 3, a major concussion, and 4, a clavicle fracture, 5, a skull fracture, all in the same practice. All freak things, not poor coaching.
At a skull fracture on a track girl. She was walking on the outside of the track by the fence, and some kids were screwing around and threw a discus and hit her in the head. And yeah, so
yeah, we actually talked about that when I talked with Kathy and Thomas about some track and discus shot put stuff. I'm not sure if you heard, but he had a dad catch a discus in the head, had an open skull fracture. Like if he moved his hand, his brain was kind of popping out. So kind of crazy. All right, so Adam, AT_Adam, said he had a football duodenum contusion. Same kid next year had a fractured manubrium. That's really strange. All right, so a first responder at the Boston Marathon.
yep,
Yeah,
winner.
that one's pretty brutal. Mavlex 20, that athlete with a pacemaker, cardiologist restricts to no contact sports, but clears him to wrestle.
Yeah, that makes sense.
Had an athlete have a seizure the day of the volleyball tryouts who did not try out because she did not have the correct medical forms completed. All right. Dexter ATCs _Dexter AT_ says athlete uses the same TENS unit on her knee that she used on her cattle to make their veins pop out, so they sell for more money. All right, so you're prodding cattle with your TENS unit there. We got Dan Morgan. Captain Morgan said a football player runs a 40-yard dash. First day of camp, ends up admitted for 5 days with rhabdo. And then a lacrosse player lost his distal phalanx when someone closed his dorm room door on it. All right, we got Herd Sports Medicine saying football kid had a stroke during preseason camp. So there you go. So since you've had your kid with a stroke, Bubba, how many times have you seen somebody else say that there was a high school kid with a stroke?
Not many.
Not many?
Not many.
All right. Maintenance guy falls out of a tree and then called him. He ended up having multiple fractures and stuff like that. So again, you got to kind of be ready for everybody. Alyssa Freeman had a college baseball player break his hand slamming it into his car door. Friends later ratted him out that he fell out of bed getting intimate with his girlfriend. There you go, another sex injury. Just keep it in your pants, boys. Nick Hoops says they had an athlete with an ascended testicle. talk about one of those things you only read in the textbooks. And I said, I'm just going to read about it. That's it. And I think it brings us to the end. What else you got? Anything else?
Mm-mm.
That's
That's
a
it.
lot. All right. So this is sportsmedicinebroadcast.com/war stories. And I believe this one's 3. Is that right?
I think so. Yeah.
So we did War Stories and then War Stories 2 and then War Stories 3 is this one. And again, if you're at NATA in New Orleans, come say hi to me, to Bubba, to Kathy, to Rob, to anybody there at the Dragonfly Max booth. And, you know, if you got somebody that you want to interview or introduce us to, then bring them there. Come be part of the show, meet us. It's really cool to know that people from all over the country will be gathered at this one spot, and people from all over the country are tuning in, listening to what we're sharing today. So come meet us, sportsmedicinebroadcast.com/war stories 3. I am Mr. Jeremy Jackson on Twitter. Bubba is ATCLAT Bubba. So contact one of us if you have some more stories, some more questions, and then we'll get them on here as best we can. So without much further ado, I think that is a wrap.